one thing I do at my clinic to extend the benefits without people having to come to my clinic that often is I prescribe a ketamine spray for at-home use, and that has really helped a lot of people. A lot of my patients have called it a game changer because they'll use it as needed if they're having a panic attack. 1 to 2 sprays in each nostril, and boom, it zaps the panic attack. Whereas previously they were taking, for example, Xanax or Ativan, and yes, it would calm them down, but it also have that post groggy effect, and they wouldn't be able to function, for example, at work or socially. With the ketamine spray, you certainly can function after 15 minutes. Um, so certainly it's the re-exposure of the brain to ketamine multiple times that causes those molecular changes. But one does need intermittent boosters, and that could mean once a month, that could mean once a year, and everything in between.
I'm glad that you brought up the nasal spray. I was actually about to ask you about that. What are some of the? Is it pretty similar as far as the experience or what the results are from using, say, the nasal spray compared to the infusions? Or can you kind of talk about the similarities and differences there?
Right. So, of course, with a nasal spray, you're going to have less bioavailability, which means the amount of uh, medication that gets into your system versus how much is applied. So when I do or give IV ketamine, 100% of what I give goes into the patient. Whereas with a spray, you're going to have some loss to the atmosphere, some loss to the nasopharynx. So the estimate is around 40 to 50% bioavailability. So it's certainly not like the IV experience. We consider the IV infusion to be the gold standard when it comes to ketamine therapy. But it is a great microdosing modality to get in a little bit of ketamine every day if one wants, and kind of keep those molecular changes in the brain from regressing. And as I mentioned, helping with any anxiety because it does relax one. Now, regarding the experience, uh, I always tell patients to not use more than 2 to 4 sprays at a time. Of course, if one unloaded 20 sprays at a time, they could probably get close to the IV experience, but I don't want that because they're not under doctor supervision. One can fall over, hit their head, or break a hip, etc. So while it is possible with the spray to get a intense dissociative experience, I don't advocate that without a doctor being around.